Hello, I'm Dr. Omar Bay, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're here, and I'd like to emphasize caring and sharing because that's what it's all about. Sharing with each other, sharing our medical problems so that we can help each other get better. And remember, we talk about med moments. What's a med moment? That moment when you know something's wrong and you need to go see your physician. That's a med moment. But you know, even better than the med moments is happy and healthy. When we've gotten through that med moment, when we've seen our doctor and the medication is working and the pain is gone. Oh, happy and healthy. I love it. Okay, we have a great show for you tonight. And before I start the show, I want to tell you, I love the emails and tweets that you guys are giving. www.medmoments. Email me. Let me know what's going on out there. And tweet me at medmoments. All righty. Our topic tonight is asthma, a topic that we know so much about as physicians, so we want to relate some of our knowledge to you so that you can take care of yourself if you have asthma or if a family member has asthma. I have the perfect person tonight to go over this subject. Her name is Dr. Jennifer LaRosa, and she is the Director of Critical Care at Newark Beth Israel Medical Center. Dr. LaRosa, welcome to our show.
How do you do? It is a great privilege to be here again. Thank you, Dr. Bay.
All righty. You know, we got to get you back a time and a time again because you always bestow such knowledge out there.
Oh, thank you.
And an educated population as far as their health care and medicine is so important. So we always have to get you back.
Thank you so much.
All right. So we have asthma as our topic.
That's a big one.
And we want happy and healthy.
Yes, we do.
Oh, yes. So my first question, as usual, is what is asthma?
Asthma is a condition that is unfortunately all too common in this community and in every community. Right. 2 of my 4 sons have it. My daughter has it. It is an incredibly common disease which is characterized by inflammation or swelling of the cells in the lungs, and the smooth muscle constricts, it tightens up. And what that means as a person is that you feel pain in your chest and you feel like you can't catch your breath, and it may actually feel like you're hearing a whistle when you breathe, and we call that wheezing. Okay, all right. So let's step back and break down some of these things that we're talking about. We're actually talking about the airways doing something like getting smaller or narrower. Yep, that's exactly right.
And it's because you said the muscles. Where are the muscles in these airways? Are they, just tell me.
They're right part of the circle. So if this is an airway, the muscle's right in there.
Right.
And what happens in asthma is that the airway closes down, it tightens up, and it becomes smaller.
Okay.
And the problem is not so much that you can't get air in, but you can't get air out.
Oh.
And so the lung fills up, and you can't breathe if your lungs are all filled up. Take a deep breath.
Right.
Now try to breathe more. It doesn't work.
Right.
You can't do it. That's asthma.
Okay. Tell me, what is wheezing? Why do I hear that noise? What's going on with that? You know what I mean?
Right?
Is there a little animal in there that doing a whistle or something like that?
It sounds like there's a bunch of little mice in there, doesn't it?
That's what it sounds like.
Well, what it is that the airways are so narrow, it's the air trying to get through them. So if you hear air whistling by your window when it's trying to creep in a crack in your window, and you hear that same high-pitched sound, that's whistling through your airways because they're too tight.
Okay. And you were talking about things like mucus production. All right. Tell me, why do we develop all this mucus? Because I know some of the asthmatics, they come in, they're coughing and so much mucus. What's going on with that?
Well, unfortunately, that's our body's response to asthma. Okay. So something will trigger asthma, and we can certainly talk about that. Right. And what the body does is it says, oh no, I don't want that. I'm gonna tighten up and not let anything in, and I'm gonna produce this mucus that'll be sort of a barrier against letting these allergens in.
Okay.
So we have increased mucus and we have tightening airway. Right. And those two things together make breathing really tough. Okay, all right. So you basically come down with shortness of breath. You sure do.
You have a lot of coughing, a lot of phlegm coming out, and all of this kind of stuff. Oh boy, all righty. Well, the thing of it is that I got to ask, is asthma an infection Is there any infection associated with asthma?
It's not. Asthma in and of itself is not an infection. It's an inflammatory response, or the cells are becoming inflamed. It's an inflammatory response to the environment, usually something in the environment. It's not an infection, but it does make it more likely that you can get an infection.
Oh, okay.
So if I have asthma and you have a cold, I'm not going to be hanging out with you too much.
Uh-oh.
We're not doing the show that time.
Okay, I have it. Now, tell me about what age do you usually get asthma? When does it come about?
That is a great question. There are 2 times in life when asthma comes about. Typically in childhood, usually by the age of 8. And then for some reason, again, there seems to be a resurgence of the disease, again, in people in their 40s and 50s, roughly.
Okay, all right.
Now, we know that if you have it in childhood, there's an increased likelihood you're going to have it in adulthood. We know that 3 things make it more likely that if you have it when you're a kid, you're going to have it when you're a grown-up. That's being a man or being a boy. That's having really bad disease, having very severe asthma, and it's getting it real young.
Oh, all right. Then.
So those kids who get it when they're 1.5 years, 2 years old are more likely to have it for life or to get it again later.
You know what I hear often, not often, but occasionally,
Yeah.
that I grew out of my asthma.
Yep.
Is that possible?
Sure is.
Oh.
Absolutely. Yep. And those patients who are female, who have less severe disease, and who get it when they're older kids, are more likely to grow out of their disease.
Okay.
We don't completely understand why that occurs,
Right.
but we're glad for those who are that blessed.
All righty. Tell me about, as far as certain races,
Yes.
if you're African American or if you're white race, is there differences in asthma or the ability to have asthma, number one, or the severity of asthma,
Absolutely.
depending on your race?
Both the frequency and the severity of asthma are increased in African American populations, in Hispanic populations, and in Native Americans.
Oh, okay.
Yeah.
All right. All
Yeah.
right. So they have to be very careful.
They absolutely do. And what it's our responsibility, I think, to educate them so that they know when they're feeling short of breath, it's not just a cold.
Right.
You know, it may be something you need to look into further and find out whether or not it's asthma.
I hear you. Family history.
Matters a lot.
All right, you open the show stating that there is, that it's in your family.
Yep.
Tell me about family history. How important is that?
It is incredibly important. The likelihood of having asthma is 3- to 4-fold increased if you have a first-degree family member who has it. So if my mom or dad had it, or my brother had it, it's 3 to 4 times increased likelihood that I'm going to have it.
Okay.
If I have it, it's 3 to 4 times increased likelihood that my kids are going to have it. So it is very, very important to know whether or not your patient's parents and siblings have experienced this disease.
Okay. Is there a particular gene that, like as doctors, that we can look for and say, oh, you're going to have asthma because you have this gene? Do we have that mapped out yet?
Unfortunately, that has not yet been identified.
Okay.
We have not yet mapped out the gene for asthma, but that would be critically important to do. And I know that there are people looking at that.
All righty. Good. Tell me about how a patient that has asthma or may not know they have asthma,
Yeah.
how do they present to your office that you as a doctor would think this patient may have asthma?
Typically one of 3 ways. People associate asthma. If you go out into the community and you say, what's asthma? They're going to say it's wheezing, it's that whistling sound.
Right.
I think that folks in the community have really begun to understand that asthma can be something that wheezes. Not everything that wheezes is asthma,
Right.
but asthma
Okay.
almost always wheezes at
all
some
righty.
point in
You
its...
mean other diseases can wheeze as well?
You betcha. Oh,
Oh,
absolutely.
all right.
Sure. But asthma is something that at some point in its disease course typically does have some wheezing associated.
Okay.
So wheezing is one way. The other way is chest pain. Asthmatics often describe feeling that their chest is tight, that they can't get a good breath in. And the third way, and I really think we need to recognize this in our young people who these days are participating in sports all the time, is inability to participate in sports to the level that they'd like to. Saying, I just can't run as far as I used to. Or, I play baseball and I'm just tuckered out by the 3rd or 4th inning.
Interesting.
And I didn't used to feel like that. What's going on, Doc?
Right. I didn't ask you this before, but are there people that may not experience asthma as a child, but when they get older, all of a sudden it comes on?
You betcha. Absolutely. And we don't really understand why that subset of individuals exists.
Okay.
But I have a number of patients in my clinic, and I'm sure that you do too, who didn't have childhood asthma or didn't know that they had childhood asthma and are now presenting as adults.
Okay.
And I would venture to guess that the vast majority of them just simply didn't know they had it as children.
Right. Obesity. That's such a wide problem now in the United States.
Yeah, it sure is.
Is that a factor as far as asthma is concerned?
It is absolutely a factor as far as asthma is concerned. And when we look at population studies of areas in the country where obesity is a major problem, asthma is also a major problem. There's a whole lot of cross-reactivity between asthma and obesity, and we really don't understand why. Not only is asthma more common in patients who are obese, it's more severe in patients who are obese.
Okay.
And we don't really understand why, but that's critical information that we need to have.
Okay. I have, I've known people that when springtime comes around, and the flowers are blooming and the trees are nice and green, and they're sneezing and all, and they're miserable.
Yeah.
Can that be asthma or related to asthma, or does that increase patients' symptoms of asthma if they have asthma? How does that relate?
Asthma and allergies are related.
Okay.
So a lot of people don't realize that if you had, or one of your babies had eczema when they were an infant, that's an increased risk factor for asthma. Allergies are also related to asthma. You can have allergies and not have asthma, and you can have allergies and have asthma. But we clearly understand that allergies exacerbate asthma. They can make asthma worse. And we try to educate all of our asthmatics to understand what things trigger their asthma.
Okay.
Is it going outside and playing in the park in the middle of springtime? Well, if it is, you can't do that as much, or we need to work harder to control your asthma better.
Right. What about change of seasons? Just hot, cold, hot, that kind of thing?
I have a couple of asthmatics I'm thinking of right now in my practice who winter and summer are fine, but fall and spring are just torture. That's the time when they really get exacerbated, and for whatever reason, that's their trigger. Pollen levels are typically highest during the early spring. As summer gets going and as it gets hotter, a lot of people actually do better.
Okay. Are there different areas of the country that one would tend to move to just because you have asthma?
We used to think that that was a good thing. We used to recommend that patients with asthma or other lung diseases move to the Southwest.
Okay.
These recommendations are no longer widespread.
Okay.
Everyone's triggers are different, and telling people to move to different places simply exposes them to different risk factors and different triggers for their asthma.
Right. You mentioned the magic word, trigger.
Triggers.
Okay, I love it. Asthma triggers.
Yep.
Now, I'd like to talk about some of them because I know that, we all have, well, not everyone has, but a lot of us have pets.
Yeah.
And the number one pet that I'm thinking right now are the cute little kitten. Oh, they're just so cute.
They are, aren't they?
But they create havoc. Tell us about why do kittens create such havoc with asthmatics?
Cat dander, for some reason, is an extremely powerful allergen for asthmatics.
Okay.
Now, we used to think it was actually in the cat hair, but it's not. It's in the cat skin. And I've got someone who's allergic to cats in my family. And I said, well, you know what then? It's the cat hair. We're going to get a hairless cat. And we went and we saw the Sphinx cat. Cats who have no hair.
I have no hair, right.
Allergy was just as bad, if not worse. It's something in the oils that they produce in their skin that's highly antigenic for asthma. And it makes asthmatics just go absolutely nuts.
Right.
Cat dander is very common. Dogs even in some people.
Oh, really?
Yep. There are even some dogs now that are known as hypoallergenic breeds because they have decreased.
Hypoallergenic. I can't spell that, let alone say
Neither can I. But the dogs are really cute.
Okay. Hypoallergenic. That means it doesn't cause allergies.
As much.
Okay.
Yeah, that's right. That's right.
All right.
Other things for people are the weather.
Okay.
Which you've pointed out, pollen. And you know what's a big one, especially in our community here in Newark? Cockroach droppings.
Oh, all righty.
Who knew? Who knew?
Right.
But it's very well studied. And if you see cockroaches running around your house or your apartment, and you think you might have asthma symptoms, that could be a factor.
Could be a trigger.
Yeah.
What about, I know, what's they're called, the mites, the
Dust mites. Yes,
yes.
Dust mites are a huge factor. That's
Now,
absolutely right.
I have a hard time grabbing this concept.
Yeah.
Because they're so small. Where are they, or where
They're
do they?
everywhere.
They're everywhere.
They're absolutely everywhere. Dust mites are virtually impossible to eradicate or to get rid of.
Okay.
Unfortunately, they're everywhere, and a lot of these allergens are everywhere. You know, if you said, Dr. Bay, I'm sorry, but you can't be exposed to pollen anymore. I'm not sure where I'd tell you to live.
Right.
Perhaps Antarctica, but I don't think you want to go there.
No. No.
There are certain things we just can't avoid.
Right.
So we need to try to minimize our exposure to them and maximize our recognition of when we're starting to have a problem, when we're starting to have symptoms related to exposure.
What about certain things around the house, like rugs on the floor?
Well, that's another great question. Unfortunately, rugs, certain types of blankets, even certain types of draperies are more prone to harbor dust mites, even cockroach droppings. So in my very severe asthmatics, I actually recommend that they have hardwood floors and that they have Venetian blinds. They don't have drapes, and that they wash their bed covers at least once a week. And that helps reduce dust mites in the entire home.
Right. I was reading somewhere that they put like covers over the beds or something like that, or over the pillow. Like, is it plastic or something like that?
It is. It's a plastic nylon preparation, and they do it both for dust mites and they do it also for bed bugs, which I'm sure you know have increasingly become a problem, everywhere. And they are protective. But the best thing you can do is wash your sheets at least once a week in hot water.
Oh, really? Very hot water?
Got to be hot water. Yep.
Okay.
Got to be hot water. The cold water doesn't kill them.
Okay. All right. Let's talk about, as opposed to allergens, let's talk about irritants. Irritants. And the big one I think about is how many patients come into my office and wheezing, and I say, well, do you smoke?
Right.
And you know what the answer is?
The answer is yes, too much of the time. You know, we're not doing as good of a job as I wish we could do with helping people quit smoking. People are addicted to nicotine. We know that it's addictive. Unfortunately, it's also a massive irritant for patients with asthma. Now, I feel worst for the folks who have a smoker in their home, and they're not even the smoker, and their asthma is getting worse, and they're not even the one doing the smoking. And I think we have to encourage our family members and our loved ones to take it outside, or better yet, to quit.
You got it. You got it. What about as far as smells, like strong smells? Like I was walking down the street and, boy, that's barbecue sure smell good.
Oh, I bet it does, but the smoke from it isn't good for you. And neither even are very strong perfumes. Very strong perfumes can set people off. The smell of certain detergents can set people off. Even inhaling certain things like if you're using swabbing alcohol to wash something on your hand, that aroma, that scent can set someone's asthma off. Everybody has different triggers. And you and I have heard it all.
Yeah, we've heard few. There's something that, and I know for the kids it's very important, and athletes it's very important. Exercise-induced asthma.
It sure is. Yeah.
Tell me a little bit about that.
Exercise-induced asthma is analogous to cold-induced asthma. So we have a lot of patients, as you know, in the early winter who say, I went outside and my chest got tight and I heard that whistling. Well, exercise-induced asthma is very similar. It typically hits 5 or 7 minutes into the exercise period. And it's usually a kid who tells you about it. And he or she says, I was doing fine playing in my football game or my softball league, and I just suddenly felt like I couldn't get enough air. And I felt wheezing and I felt chest tightness. That is exercise-induced asthma. If we know about it, if we recognize it ahead of time, we can not only treat it ahead of time to prevent it occurring, but we can allow them to enjoy longer exercise periods, to tolerate longer exercise periods.
Are there some sports that an asthmatic would be, it would be easier for them than other sports?
You know, if my asthmatic patients come to me and say, listen, I love running, I want to be a runner, I say, that's great. I hope you're a good sprinter, because marathons are not for you. You want to do the shorter sports, the baseball where you run the bases, the football where, maybe you're not the running back, I guess. The sports that are more time limited in terms of your exercise output. What's another good example?
Swimming.
Swimming is a
Yes,
great example.
that's one that I
Swimming
always
is a
think
great
about.
example.
Yeah.
Very good for asthmatics.
Yeah, yeah.
The shorter course sports are better.
Okay, all right. Definitely, definitely. Now, tell me about, as far as we talked about the disparities, some of the disparities, and the different, the African Americans,
Yeah.
the American Indian, and the Hispanics, especially Puerto Rican Hispanics.
Yes, that's right.
Tell me about the differences between, well, if you're in an affluent neighborhood
Yeah.
or a low-income neighborhood,
Sure.
as far as the asthma and your those people getting asthma and having,
Sure.
actually, I would say, exacerbations of their asthma.
We do recognize that people in less affluent communities seem to have an increased risk for asthma. Why is that? Is it because they are exposed to more allergens? Is there more dust there? Are there more cockroaches? Do they not have the same filters in their homes? Or is it something that's related to a genetic predisposition? And I honestly don't think we know the answer to that yet. I really don't. I think that those two factors are confusing the situation so much that we don't know what's socioeconomic and what's genetic. And we need to work on that. Right now, it looks like patients in more affluent communities have less asthma. But I don't think we understand why.
Okay, all right then. In these low-income areas, do you find that these patients go to the ER more, and do they come in worse?
Yes,
than
they absolutely do.
Okay.
I find that they use the emergency medical services more, and they tend to be sicker. I have some patients, again, in my practice who are such severe asthmatics that they're literally always on some form of treatment for it. Now, it may be that it's just under-recognized, and we need to do a better job getting out there into our communities and saying, hey, you know what? This is what asthma is. We need to go to our churches and our schools and our community centers and educate people so they recognize it early.
Right.
That may simply be something that we're not doing well enough.
Do you find that patients that recognize it early and get that early treatment are less likely to be hospitalized?
Absolutely, no question about it. No question about it.
Okay.
We don't want to wait until you're having a flare-up. We want to know that you have asthma, and we want to keep it tampered down.
Right.
That's the key with all diseases, really.
Right.
Right. If you're diabetic, I don't want you to take a week off taking your insulin.
Right,
I
sure,
want
sure.
you to take it faithfully, just like you do every day, and that way I don't want to see any flare-ups.
Right, right. Tell me about asthma death. Do patients still die from asthma?
Isn't it amazing that the answer to that is yes? It's heartbreaking.
Yeah.
It's just heartbreaking. Kids still die of asthma. Adults still die of asthma. And I think that the two main reasons that they die is under recognition and under treatment. And we have to fix that.
Right.
This is not a disease people should be dying of anymore.
Right.
It's preventable, it's treatable, and it's manageable, and there's no reason anyone's life should be shortened because of it.
Right, right. Now, how do we diagnose asthma? You know what I mean? I mean, what do I do as a doctor? You just come in, you're wheezing. So how do I tell that from maybe you got a bad cold and
Sure.
or something like that?
Yep. Well, you know the answer, of course, more than I do. We do pulmonary function tests.
Okay.
And we bring you to a part of the hospital, and you sit in a small glass box, and you literally blow into and out of a machine. And it tells us about how the air moves in and out of your lungs.
Oh, okay.
And we can literally diagnose from that, from our training, whether or not someone has asthma.
Right, right. Go ahead.
No, well, I was going to say that
go ahead.
at home you can also tell whether or not your asthma is getting worse.
Oh, okay.
Because we have a pulmonary function test, sort of a portable one, that you can take home called a peak flow meter.
Oh, okay.
It's about that big. Pretty neat.
All righty, all righty. So that'll tell you, if you do it at home, it'll tell you if your airways are open, and if they're not,
Yep.
then what do you do?
You call you.
Oh boy. You're in trouble if you
I
call
know.
me.
No way. Are you kidding?
Okay. There's something I want to go over, and it's called an asthma action plan.
Okay.
Tell me a little bit about this. Why should an asthmatic and the families of the asthmatic have a plan of action?
Because you want to break the flare before it gets to the point where you're going to die or you're going to end up in the intensive care unit. So if I'm an asthmatic, I am going to take my medications faithfully every day, precisely as my doctor prescribes,
Right.
regardless of how I feel. The first time that I feel a twinge of anything, a little bit of cough, a little bit of shortness of breath, a little bit of wheezing, not only am I going to let my doctor know, but I'm going to put my action plan into effect. I'm going to start using my peak flow meter more frequently and checking to see if my levels are abnormal, because that's going to tell me that I'm doing worse. I'm going to communicate all of this to my doctor. And as soon as I get to the point where I or my doctor feel like I can't tolerate this, I'm going to go in and see him or her. But this is going to be clearly spelled out, so I know exactly what to do at every phase of how I feel.
Okay, all righty. And what about as far as going to the ER? How do you know it's, I don't even have time to call my doctor. It's 911 time.
If you feel like it's 911 time, then you need to go, and we want you to come to the emergency
Just the
room.
thought of 911, it's that time.
It's that time.
Okay.
Absolutely. You can't live if you can't breathe.
That's true. That is true.
Yeah.
Now, what about as far as, we just have a few, like about 30 seconds to go. What about as far as families and having families more educated, not only the asthmatic patient, but the family as well, used to understanding the triggers and the clues that they should know to make sure that they move that patient along?
Every disease is a family disease. If I'm diabetic in my family, then my family understands that I can't have M&Ms for dinner. The same thing is true of asthma. My family has to recognize what my triggers are, how we avoid them, and what we do when I need help. Now,
there are, just real quick, not to go into medicines and everything, because we're ending up here. There are the meter dose inhaler. All righty. It's so important that they use that properly. And I feel that a lot of patients, well, you should answer the question.
No,
they should
but you're
ask their
exactly
doctor
right.
how to use this.
Yes.
All right.
Make your doctor take the time to go over it with you.
Right.
Everybody thinks, well, everyone knows how to use pumps and puffers. They don't.
Right.
Make your doctor take the time. It's his or her responsibility.
Okay, it was such a great show, and there's so many great questions, and you answered them so well.
Thank you.
Of course, we're going to have you back.
Oh, thank you so much.
Thank you very much, Dr.
Mine.
LaRosa, for coming in and doing asthma.
My honor.
In closing, remember, never, never institute any change in your medical care before you consult your doctor. Sharing and caring. Email me, tweet me, www.medmoments.com or @medmoments. I trust that each and every one of you have continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. All righty. Thank you very much. Oh, yeah, excellent. Oh, no, everything was fine. They covered the topic beautifully. I really, really, really loved it.
Thank you.
So,
I'm sorry, I totally feel bad. I didn't mean to interrupt you at that
No,
point.
that's all right. But as far as